This module focuses on understanding balance and relevant interventions to improve balance in people with MS. People with MS commonly report loss of balance, and more than half of people with MS have fallen in the past 6 months. The mechanism contributing to balance impairment in MS can vary from person to person and may include any combination of sensory, motor, and cognitive processes. That said, slowed somatosensory conduction and impaired central integration are the most common contributors to imbalance in people with MS. There are many facets of balance interventions. Research has proven that balance deterioration often begins early in the disease process with MS and is detectable with balance testing prior to clinical signs of imbalance. Thus, there is support for early balance testing in patients with MS and patient education to maintain function and on how to slow progression of balance impairment. The evidence presented in this module will primarily focus on the efficacy of balance activities that aim to improve postural control. A study compared 3 interventions in an inpatient rehab setting: balance rehabilitation to improve motor and sensory strategies, balance rehabilitation to improve only motor strategies, and conventional therapy not aimed at improving balance. The greatest improvement in balance was in the subjects receiving interventions for both motor and sensory strategies compared to only sensory strategies or conventional therapy. Over the course of the study, patients in all groups reported reduced number of falls, but a greater reduction was seen in the groups receiving the motor strategies or the motor and sensory strategies. Fitness kickboxing includes fast, interactive movements of the body and limbs, high-intensity exercises that incorporate full weight bearing, and activities that challenge the visual and vestibular systems. In a study of 15 persons with MS, significant outcomes were seen with several balance measures after 15 seconds of group kickboxing. A larger improvement on the mini BEST test and the ABC was seen for subjects with greater disability. The EDSS of individuals in this study was from 6 to 6.5. Kickboxing-type movements are effective at improving balance and can be modified for the clinical setting. A randomized controlled trial evaluated a 6 to 7 week Nintendo Wii Fit program to improve balance for people with MS. A physical therapist was in control of the remote, but participants were allowed to choose the Wii games they enjoyed. After 12 30-minute sessions, participants showed a significant improvement in tug cognitive, time chair stand, and the dynamic gait index. Adherence to the Wii Fit interventions was excellent. Of the 41 subjects in the intervention group, all but one completed all 12 sessions. There are numerous studies on the benefits of Tai Chi for balance in older adults. A pilot study of Tai Chi for MS resulted in significant improvements for balance and depression. Participants ranged in level of disability from walking without an assistive device to using a wheelchair for all mobility. There was also a high rate of adherence to practicing Tai Chi at home. The majority practiced for longer than 2 hours a week. Of the 4 dropouts, 2 reported not liking the Tai Chi exercises. Thus, Tai Chi may not be for everyone, but for those who are interested, it can have a significant effect for balance and motivation to adhere to home exercises. A multidimensional home exercise program can improve balance in people with MS who have varying levels of disability, from EDSS 1.5 to 6.5. This home exercise program was designed to address specific impairments associated with MS, including vestibular dysfunction, weakness, sensory disturbances, and decreased range of motion. The program included 11 exercises performed in either seated and standing to improve static and dynamic postural control, vestibular and visual systems, ankle strategy, strength, and posture. The exercises were performed 3 times a week for 6 weeks and resulted in an average 6-point improvement on the Berg, significant improvement on the SOT, and improved excursion to limits of stability. This study on bodyweight-supported treadmill training included 4 subjects with EDSS of 7 or 7.5, meaning they relied on a wheelchair for mobility. The study used 3 people to assist with treadmill training and included up to 42 hours of training. Although this amount of training may not be feasible in the clinic, it is still helpful to know that 2 hours a week of activity can improve function for patients that are primarily wheelchair users. The intensity of training was also well tolerated by all subjects. 2 subjects had significant improvements on the Berg balance scale. There were also improvements in other measures including spasticity, strength, fatigue, walking speed, and endurance. Subjects also reported improvements in some ADLs, including transfers. Considering all of these studies, balance is a complex and multifaceted impairment that needs unique interventions based on individual patient presentations. Task specificity should be utilized for patients with balance dysfunction because optimal interventions must target the specific causes of imbalance that limit function. This concludes the module on balance interventions in individuals with MS. Please proceed to the module post-test and continue to explore other modules that interest you.